big story right now. They haven't used the word lockdown, but in effect, the orders which the Chief Minister Uddhav Thackeray has announced for Maharashtra are very, very stringent indeed. Given the COVID situation and the escalating number of cases seeming to indicate that the situation is fast out of control. I'll talk about the main points that he has mentioned, but I think the context also needs to be stated. He did say that there is an acute shortage of oxygen, increasingly in parts of the state. He is appealing for help to get more oxygen. Hospital facilities are at maximum right now. No matter how much more capacity he is able to add, that's getting filled up right now. But what was really worrying is what he spoke about, the oxygen situation getting very, very difficult, even though availability has been stepped up. Also spoke about exploring whether the military needed to sort of come in to help with the supply of essential items, presumably oxygen at this stage. So, imposition of Section 144 and night curfew, that's been announced. So, no assembly in significant numbers. That's been imposed for 15 days across Maharashtra. No one will move in public places without valid reasons. All establishments, public places, activities, services shall remain closed, except those clearly mentioned, and there are quite a few exceptions. Services and activities mentioned in the essential category are exempted. Their movements and operations are to be unrestricted. Services and activities in the exceptions category are exempted from 7 a.m. to 8 p.m. on working days, and their movements and exceptions are to be unrestricted during these periods. So essentially 7 a.m. to 8 p.m. is when there would be very strong restrictions which are in place. Again, and I just want to reiterate that I am reading this out just on the basis of what we've just received now. So there would be many a slip between cup and lip, but you would need to go through these, and I'm sure this would be brought out in a great deal of detail, which we will do as well as we go through this. So a decision regarding the inclusion of domestic help, drivers and attendants to work in the exceptions category will be taken by local authorities based on local conditions. Essential categories they've identified, this includes hospitals, diagnostic centers, clinics, vaccination, medical insurance offices, pharma companies, those involved in transport and the supply chain, manufacturing and the distribution of vaccines. All of that is important. That will remain. Veterinary services remains, groceries, vegetable shops, fruit vendors, dairies, bakeries, confectionaries, all types of food shops. These are essential. They will remain open, but with very strict guidelines. Cold storage, warehousing services, that's open. Public transport, so trains, airplanes, taxis, autos and public buses will remain, again with conditions. Services related to the functioning of diplomats continues. Pre-monsoon activities by local authorities will continue. All public services by local authorities, that will carry on. Transport of goods, water services, all of this. So a lot of exceptions. So this is a very significant modification to a complete lockdown. It's meant to ensure that there is a minimum breakdown of essential services, which a lot of people complained about last year. But it's still going to be very, very stringent. Let's go across to, who do we have? Let's go across to NDTV Saurabh Gupta, who's been tracking all of these developments. So the bottom line is, what, 7 a.m. to 8 p.m. There would be Section 144. So the right to assemble has been curtailed for what, 15 days, right?
Absolutely. Section 144 across the state, which means that if you cannot convince enforcement authorities that you do not belong, or you do belong in fact to a category that's exempted from these restrictions, then obviously the state can take legal action against you. Now, a lot of things that were perhaps missing last year and that really hit people hard last year during the lockdown seems to have been addressed here. One was the lack of public transport. The non-availability of public transport had really hit people hard. Secondly, now look at this situation. There are street side vendors in Mumbai, and remember, they feed a lot of people. A lot of people of Mumbai live on the streets. Who looks after them? Who feeds them? So their needs also being taken care of in this announcement. This is something that even the opposition had pointed out, to be fair, and that seems to have been taken into consideration by the government here. Also, what we know is that, flights are functioning. trains are functioning, but avoid non-essential travel basically. Travel only if you have to at this point, and that's something that is being made very clear. So you will have all the things that you need in case there is an, that there is an emergency or there is something that's absolutely essential. But what the Chief Minister is basically appealing to the state is that, look, this is not a full lockdown. This is, of course, something that is very strict restrictions. But at the same time, it's being balanced out with exemptions that will ensure that people don't go hungry, people don't have, food to eat. So all of those issues have been taken care of. For example, the Shiv Bhojan Thali, which is the flagship scheme of the Shiv Sena, which was provided at ₹5 a plate, which was a full meal. That is now going to be provided free of cost. So while the Chief Minister, used the term Rozi Roti, he said, Rozi to shayad I cannot, sort of ensure for everyone in these 15 months, but Roti I can, which means that no one sleeps hungry. So there's an important balance of
all right, Saurabh, we'll try and look at a lot of those points, but I need to go across now to Priyanka Chaturvedi, Rajya Sabha MP, leader of the Shiv Sena, who's with us. Dr. Jalil Parkar, senior pulmonary consultant at Leelavati Hospital, with us as well. And Dr. V. Ravi, the head of neurovirology at Nimhans and a member of the International Advisory Board of Sputnik and an advisor to the COVID-19 task force in Karnataka, joins us as well. Dr. Ravi, we were meant to talk a lot about Sputnik, but the events in Maharashtra have really overtaken things. But I'll come to you in a moment, Dr. Ravi. But Priyanka, you aren't using the word lockdown, and perhaps understandably so. How have all of these moves been done to ensure that, basic services, continue, people get their food, but there are very strict restrictions, you can't move about. So could you just tell us some of the key things which are different from last time around?
So some of the key things that are different and some of the key things that we need to keep in mind, because of which we have these strict measures in place, is about what the Chief Minister very honestly in his talk to the people of the state has said, that we are running out of beds, we are running out of oxygen, we have remdesivir issues. So we also need to ensure that we break this chain and this cycle. So what we've managed to balance is that essential services, we've identified them very clearly. We've not shut down public services, public transport, so that there is no restriction of travel for those who are essential workers. We've also kept in mind those people who are dependent on state for food, or ensure that even the rickshaw chalaks, even our, the people who are street hawkers are also taken care of. So he has very elaborately explained how we've managed the balance and how the state would cooperate with every single resident in ensuring that there is no disruption of life per se, but there would of course be restrictions in terms of travel, in terms of stepping out of homes, that we need to think 10 times before we step out of homes if we have no essential work. So in terms of travel also, we must understand, so if there is someone who's traveling to Delhi, etc., the flights haven't stopped. They can travel with a valid ticket. So those are things that have been kept in mind, and we have maintained a fair balance to ensure that there is no disruption, but rather break of chain.
I'm just interrupting you because, with lots of messages, obviously people want to know about can they go to work. And as I see it in the exemption category, the following offices are allowed. So offices of central, state, local governments, including statutory authorities, cooperative, PSU, private banks, that's important. Offices of companies involving essential services, insurance, Mediclaim, pharma companies, RBI regulated entities, right? All non-banking financial corporations, all microfinance institutions, offices of advocates, if courts are on. And these should work, however, with only 50%. So normal people, those who work, for example, in companies or firms, this, that and the other, they can't go to work, right?
No, they'll have to find out work from home because many of them had transitioned from work, from being offline to taking it online. So many of these private companies are already used to the idea of working from home. And I think that is something that we put in place for 15 days to ensure that we manage to recoup all our services and ensure that there is no challenges in terms of providing treatment and facilities to people who are unfortunately suffering from COVID.
And this is obviously going to bring down the numbers on trains drastically if only essential people in all of those categories are there. So a fraction of the normal people would be actually allowed to travel. That's the bottom line over here.
I think also we must understand understand that this particular restriction would also ensure that our vaccination campaign continues, and we try to partially vaccinate. Like he gave you he cited the UK example, that during that lockdown they ensured that they ramped up their vaccination drive, and they partially vaccinated a huge percentage of population. That would also be our aim, to ensure that we are at least reaching a higher level of percentage coverage in terms of vaccination.
Okay, Dr. Jalil Parkar, we spoke to you about the situation at Lilavati Hospital a few days back. The Chief Minister is speaking about a shortage of oxygen. Could you specifically refer to that? What is the oxygen situation in your hospital right now, and some of the other doctors that you've been speaking to?
Well, in my hospital, we do not have the shortage of oxygen the way it is in other, I think, satellite cities and in towns also. And I think in the villages too. Some people the other day had called me from Nasik. There was no oxygen over there. And I'm sure in some other cities also is the issue. But in Lilavati, we do have oxygen. Yes, we do find it difficult sometimes when we have excess of patients, like you all have seen that video where we have the beds in the lobby. But we do see to it that oxygen is given to all those who require.
And doctor, in terms of patients, the data suggests that a lot of young people are now falling extremely unwell. Children, even under the age of 18, there's been a rise in that percentage. Could you tell us about that? Clinically, are you seeing that as well?
Initially, we had not seen this around a year back, or maybe 8 or 10 months back. But in this surge, we are seeing the youngsters getting COVID-19, but they are not that critical. They can be treated either domiciliary at home, or if required, they come to the hospital, but they go back home on the 5th day or the 6th day. So the criticality is not there. And partly because I think herd immunity is there. Number two is that the vaccination program that is going on, I think everybody is trying to take those vaccinations. The youngsters were not getting the vaccination. So there is a surge in the volume of patients that are coming to hospitals, and that is humongous. But the criticality, I would say, that is much less. In certain cities or in certain hospitals, the criticality might be even more. I do not know that, but that could be because of lack of certain facilities or expertise.
Sir, just one moment. I'm running short on time. I quickly want to go across to Dr. Ravi. Sir, today is an important day. Sputnik, among other, has been rolled out. I mean, the permission is there. There will be other vaccines which should also be coming in. But let's talk about Sputnik first. How soon before we have adequate numbers of the Sputnik vaccine? Because we need more doses, whatever approved vaccine we get.
Thank you, Vishnu. And to answer that question, the CDSCO has to give the approval first. After that, the Reddy Laboratories is the first company that is going to make the vaccine available. I would believe a lead time of 4 to 6 weeks is required before it starts being supplied to the public for use. So it's not that today you give approval, tomorrow you're going to get it. They have been doing their productive activities, but then, there are some regulatory requirements like batch testing, lot verification, batch verification. These things will take at least 4 to 6 weeks before the vaccine is available.
Dr. Ravi, again, for the benefit of citizens who want to know how many doses, how many days apart as far as Sputnik is concerned, and how efficacious is it?
The Sputnik vaccine is a 2-dose vaccine. It is 21 days apart. The trial results published said that it is 91% efficacious. Let me make it very clear. The efficacy was measured by monitoring infection in those who received the vaccine versus those who received placebo. Having said that, I must tell you, when it comes to severe disease prevention, the vaccine is 100% efficacious like all other vaccines. All vaccines licensed for human use are effective in protecting against severe disease and death.
That's really important. Priyanka, just one more quick word to you. You know, I heard the Chief Minister mention that he might ask the armed forces to help. Why is that necessary? I'm just trying to understand.
No, I think that was just for the oxygen bit, because he did mention that we've asked for oxygen within the 1300-kilometer radius within the state. But because they're traveling by road, it's taking a lot more time. So he's looking at these options. He did not say he would want to call them in.
So logistics.
But he's looking at these options.
Support
Logistics,
possibly.
yes, just to maintain. Yes, that is what we're looking at. And just one thing I'd like to mention here, Vishnu, is the difference between the first lockdown and second lockdown that you've not lockdown. I would say break the chain. Was something that came from the center to us. It was we were just given 4 hours. We were told to shut down everything. But here we have ensured that there is a balance which is maintained and lives are not disrupted. And we are taking care of everyone, and whether it's their meals or trying to ensure that if their livelihoods are impacted, we give them some amount of money to be able to pull through in these 15 days.
No, that's absolutely critical, and that's not something we've had time to discuss. We'll keep doing that later. I'd like to thank you very much for joining us. A huge financial package also has been announced so that legal hawkers, for example, get 1,500 rupees direct deposit in the bank. There are 5 lakh beneficiaries over there. The Shiv Bhojan scheme is now free. I think it was 5 rupees earlier on. For 1 month, beneficiaries will get 3 kilos of wheat and 2 kilos of rice. These are some of the steps. Authorized rickshaw drivers will get 1,500 rupees. 7 crore people will be beneficiaries of a rice and wheat scheme. More details on that later on. I'd like to thank you all very much for joining us.